Hello. Have you ever thought about the community you live in as sort of one of your most valuable possessions? Well, if you're like me, you probably considered the things the community had to offer before you decided to move here. Things like schools. Then there's parks or other public facilities. Maybe shopping areas or restaurants and entertainment. All the things you may need to enrich your life and meet your needs. So, have you considered how fortunate a community is if it has a great hospital? When you think about it, there are so many times in your life when having access to convenient, high-quality care in your own backyard is a real blessing. Well, right here in the middle of your community is Baylor Medical Center at Carrollton. There has been a hospital at this location since 1985, but in 2009, Baylor Healthcare System took ownership of the hospital. Now, there's sign after sign of how Baylor is transforming this hospital into a real asset to the community.
We've been in business for a long time here, and we've had a number of employees that have been with us for the duration, some of them 30 years more. And as we and they mature, our needs for health care are increasing. And having a Baylor facility here in our own backyard, Carrollton, Farmers Branch, Colony, has been a real treasure for us, and we're very thankful for that.
Baylor Healthcare System has made a promise to make this hospital a leading healthcare provider in the community. We have already increased our staff significantly, attracted 170 new physicians, and invested $18.7 million in an aggressive revitalization effort for both our equipment and our facility, with more investment to come.
But improvements aren't just about the money that is spent. I think it also has to be about innovation. Having a willingness to rethink and rework the way things are done to create a better experience. Well, there's probably not a better example of that than in this hospital's emergency department. How can I help you?
Our paramedic greeters identify priorities and get the patient's treatment started almost immediately. And that's just the first step in a totally reworked process that's almost completely eliminated our patient walkouts. We did this by rethinking our workflow, eliminating bottlenecks, and getting our patients back to a bed faster. We have also adopted a new heart attack protocol that has allowed us to be accredited by the Society for Chest Pain Centers. And we actually developed a new protocol here that has done so well that it's been adopted by the entire Baylor healthcare system.
This kind of sharing of experience and knowledge is one of the great advantages of being plugged into the collective expertise of one of the most respected healthcare systems.
I'm the first to tell people to move to Dallas. You don't have to worry about a hospital because you have the Baylor Hospital in our area. And I know firsthand that is committed to a high standard quality of care for its patients.
The employees here are outstanding and go the extra mile to help you. With the revitalization of this hospital, it has really added to our community.
And this revitalization is driven by a focus on quality improvement at every level. But improvement isn't just an intention. When done right, it's the result of a measurable, repeatable process.
Our entire team is always looking for ways to improve. And then we approach the improvement process very scientifically. We first identify goals, establish an actionable strategy based on evidence, educate our physicians and staff on what new protocol must be delivered, then measure the results. If the results aren't 100%, we start the process all over again until we get there.
Because of our quality initiatives, we've shown improvement in all areas of patient care. For example, in heart attack, we've been able to give the evidence-based care 100% of the time.
And if you took a quick tour of the hospital, I think you'd be impressed by improvements and changes in nearly every department. Well, like, take a look at the beautiful new rooms in the orthopedic wing, which are the model for how all rooms will be renovated. Bright, spacious, and comfortable.
We do many things here to ensure the best outcome for our orthopedic patients. For example, our preoperative classes for the patients and their families help to reduce anxiety, and the strengthening exercises put them in the best possible place for a successful recovery.
You'll also find that the new interventional radiology suite allows physicians to perform many procedures through a catheter instead of invasive surgery, which typically means a faster recovery, less pain, and less visible scarring. The hospital has also recently opened a new wound center with 2 hyperbaric oxygen chambers. Inside these chambers, patients with wounds that are hard to heal, such as diabetics and the elderly, breathe in a high concentration of oxygen to promote healing. And just down the hall is the gastroenterology department, which has been recently updated with the newest technology in the field. High-definition endoscopes and colonoscopes allow doctors to evaluate a patient with much greater detail and clarity. It's like how much clearer your HD television is at home compared to the older TVs. You might also be quite impressed to learn that right over here, Baylor Medical Center at Carrollton built 2 new operating rooms. They have the latest OR technologies, including advanced surgical microscopes that support the hospital's expanding neurosurgery department.
And soon we're going to be one of the only hospitals in the country that is going to have an intraoperative CT scan with computer navigation that will allow us to perform spine surgery with greater safety and efficiency.
And here, according to our patients, is a great place to have a baby.
Our Women's Services Department consistently ranks on the 95th percentile nationwide in the Press Ganey patient satisfaction surveys. In fact, hospital-wide, we've seen an increase in 40% with regards to patient satisfaction. Plus, we have a level 3 neonatal ICU unit offering the highest care available for sick and premature babies born as early as 28 weeks gestation.
You know, a not-for-profit hospital like Baylor Medical Center at Carrollton really has the freedom to make safe, quality, compassionate care their first priority.
Since Baylor took over, we've been provided the resources to give the nurses more time at the bedside to deliver compassionate, patient-centered care. An example is our 24/7 open access visitation. This encourages the family to be present during our shift change report, which now occurs at the bedside. This involves patient and the family in their care.
I think that wherever you look here, you can easily see the passion the Baylor staff and doctors have for their jobs. That's also pretty clear when you listen to some of the people they've cared for.
She had never had surgery before, so she was very anxious about the experience, and we had some concerns as well.
On my pre-op, they showed me the operating rooms and stuff. It really put me at ease. They even gave me a popsicle at the end.
That made us feel that they were really concerned about her experience, having a positive experience, and they were concerned about us as well.
I've been here within the last 7 months twice, 2 surgeries. Since Baylor Carrollton became Baylor Carrollton. I was also here in this hospital for surgery prior to Baylor taking over, and have noticed a tremendous difference in the staff, the food, the fact that there is a private room for everybody here.
One of our longtime employees battled cancer and was here for an extended period of time, and unfortunately he lost that battle. But his wife commented that it was such a blessing to her to be able to come here anytime, day or night, and see him and to know he was being cared for, and she was appreciated there as well.
I was here just recently, and the employees were so wonderful and so happy and exuberant while I was here that I actually went home and put on Facebook that I think that everyone at Baylor takes happy pills.
This kind of exuberance has a lot to do with the character and training of the staff. Did you know that most of the nurses here have bachelor's degrees, and many have or are working on advanced degrees and certifications?
Baylor is very supportive of the professional growth in the staff. They value staff expertise and give them every opportunity to initiate change.
Baylor has opportunities for professional development for the medical staff as well. For example, 10 doctors from Carrollton are currently attending the SMU Advanced Physician Leadership class.
Through our various system quality councils,
everyone at any level really has an opportunity to make a difference.
I think a really great hospital is also one that is in touch with and actively involved with its community.
This hospital has a strong partnership with the Carrollton Farmers Branch Independent School District. Through our Health Services Academy at R.L. Turner High School, they provide internships and resources that would not be available to us if we didn't have Baylor with us.
We are very supportive of our community on many levels. Between programs, donations, charity care, and other benefits, we've given back to our community over $47 million in just the first 2 years as a Baylor facility. This includes education, health fairs, free health screenings, and donations to help feed and clothe the underprivileged in our community.
Now that you've taken a closer look, I hope you realize the many ways Baylor Medical Center at Carrollton is becoming a very valuable asset to you, your family, and your community. But really, all of this is only the start.
It is very exciting to see the ongoing growth of our community hospital. And we have even more significant improvements planned for the very near future.
Starting with a $4.3 million complete information system overhaul.
This will support our conversion to a standardized electronic health record next year.
We're also establishing a new cardiology department
with a fully trained staff of cardiologists, nurses, and technicians.
Plus, $9.5 million will be spent on renovating 7 additional operating rooms.
And over $1 million will be spent to renovate our labor and delivery area.
We're also building an outpatient cancer center.
So I hope you're as excited as we are about the growth of the Baylor Medical Center at Carrollton and our promise to bring safe, quality, compassionate care to your community.